A secret report sat on by the federal government for nearly 5 months reveals deeply disturbing information about the state of Australia's mental health services. 730 has a copy of the high-level review and it finds there's currently no effective way to find out if the $10 billion spent on mental health each year actually improves anybody's life. Not only that, the system is so broken that it often hurts the people it's supposed to help. Talk directly to families who've lost members to depression or other mental illness and they'll tell you that's exactly the case. One of Australia's most high-profile mental health experts has now had a devastating personal taste of the system and it's burning like a fire in his belly. As Sabra Lane and Lucy Barber report, his experience isn't isolated.
No one blames themselves because, like they say, depression is a disease.
It's impossible not to be moved by this farewell message.
I love you all. There's nothing you could have done. It's just me. It's my personality. It's who I am.
21-year-old Chris Ball recorded this video for his family shortly before he took his own life.
He had left a piece of paper with Mum and Dad, please watch. He put that on the floor and then he put a, what is it called? A memory stick thing for a computer on top.
Oh, it's just, you didn't do it right. This is all me, myself. I love you. Goodbye.
For Chris's mum, Kerry Kepper, the video is a precious memory of her son.
Loved family, loved gardening, mowing, spent a lot of time with his mates, loved the water. He had a dog that he just adored and a girlfriend he adored. Every day I wait for him to call me and say, "Mum, come and get me. What's for dinner? I'm starving."
Chris's battle with depression started 2.5 years ago. He spent 2 weeks as an inpatient at Redland Hospital's mental health unit in Brisbane, where he made an attempt on his life. Kerry Kepper says Chris's condition improved after that hospital stay, but deteriorated sharply last year.
He rang me one day and was distraught. You couldn't miss that, you know, where he was at. It wasn't a case of wondering, was I overreacting? You just knew it was bad.
Chris told his mum he'd tried to kill himself. Kerry Kepper, an aged care nurse, rushed to her son's aid and drove him to Redland Hospital for urgent help. They were turned away.
He hadn't slept. He was given 10 Valium, told to have a good sleep and that somebody would contact him in a week or two from the outpatients department, and they said they didn't have any beds.
3 weeks later, while Chris was still waiting, he took his own life.
If somebody presents to an accident and emergency department of any hospital, anywhere, and they state that they are suicidal, they should not be walking out that door. They need to be helped. And my son walked out that door without help, and he's not here anymore. It's got to change, and I won't rest until it does.
They're just letting people die. This is happening every day. They don't look at individual cases.
Di Mendoza is also mourning the loss of her son.
I miss his hugs. I could never hug him again. He left his favourite. He left a lot. He left beautiful photos. He left the first watch we gave him. The first pen with his name on it. He just left so much here for me. And then his favourite blue swimmers were sitting on the hook in his bathroom and I take them to bed with me at night. It's such a comfort.
Jeff Mendoza joined the Navy straight from school. His family says he loved military life.
Best part was seeing Mum and Dad. Can't wait to go.
Jeff was on board the first Australian ship in the East Timor intervention. He was later based at HMAS Stirling near Perth.
Jeff had a wonderful sense of humour. He was a beautiful human being. Everyone loved Jeff.
Jeff's mother says he noticeably changed during his final year in the Navy.
And I got these phone calls, "Mum, I've got to get out of here. I have got to get out of here." But he wouldn't tell me why. He just said, "I have got to get out of here." It was just a desperation I'd never heard before.
He was discharged on compassionate grounds 12 years ago and joined the family's business.
He just didn't look right. It was the look, it was his eyes. And I noticed at work he would get agitated very easily, frustrated with things, perfectionism.
Within a year of leaving the Navy, Jeff attempted suicide. His family believes he was suffering post-traumatic stress syndrome as a result of his East Timor service. For the next 12 years, Jeff's family sought psychiatric and medical intervention for Jeff, and they had the best possible advice on tap. Jeff's uncle is Professor John Mendoza, a widely respected expert on mental health. He was the former Labor government's chief advisor on it. Even with his expert guidance, the system failed.
I was driving at the time when my brother rang me, and it was a call I'll never forget.
Last November, Jeff Mendoza warned his family he was planning to kill himself. Frantic, they called police, who put Jeff under an emergency examination order and took him to the Gold Coast University Hospital for an urgent mental health assessment. Yet he was discharged the next day.
No one can even tell me how he left the hospital. I know that they discharged him. I know they gave him a script. This is a script. He had no wallet, he had no shoes, he was dressed in a hospital gown. I don't even know how he got home.
I know that what service Jeff was afforded when the police brought him to the Gold Coast University Hospital was frankly appalling. And a dog hit by a car gets a better standard of care than what he did. And I have no doubt today that if he was afforded better care on that occasion back in November last year, he'd be here today.
Within 30 hours of leaving hospital, Jeff killed himself.
There was, a plan to give him a phone call on the Saturday, which they did. They actually rang an hour after he had died.
For Professor Mendoza, Jeff's death has painfully brought home what he's known for years. The mental health system is a mishmash of shared responsibilities between state, federal and local bodies.
We have a schmozzle, and the schmozzle has to end because it is costing lives. It's costing our nation dearly.
In opposition, the Coalition made a review of mental health services a priority and ordered it when it won government. It was conducted by the National Mental Health Commission. Its report was handed to the government last November. It hasn't been made public, but 730 has obtained key parts of it. The Commission says there's an overwhelming case for a radical rethink of responses to mentally ill people seeking help. It says the system's poorly planned and integrated and is a massive drain on people's well-being. It finds major deficiencies in the response received by many of those seeking help for suicidal thinking, attempts or bereavement. The report says there is substantial funding within the mental health system, but that it's not distributed efficiently, effectively or fairly. It makes the significant recommendation that from 2017, the federal government redirect more than $1 billion earmarked for acute hospital care and pump it into community-based mental health services instead.
We are still spending more than 50% of our mental health funding in acute care hospital wards. Wrong. The evidence to support that does not exist. What we should be doing is shifting that funding to the community sector. We should be ensuring that we have the capacity to reach out to people like Jeffrey in crisis, treat them in their home.
Professor Mendoza quit his position as Chief Advisor on Mental Health to the Rudd government in 2010 over its inaction, and he says it's time for this government to prove it's serious about reform.
So in 2010, 2011 again, Tony Abbott made mental health matter. Now, was that merely political opportunism, or was the Prime Minister genuine in terms of a commitment to mental health reform? I don't know the answer to that, but the longer this report is not released, the more it looks like opportunism.
A former Australian of the Year and mental health expert, Patrick McGorry, believes Australia is at a crossroads, and he says he has faith the government is committed to releasing the review.
Well, the first thing is to make the public aware of what a preventable killer it actually is, and then we need evidence-based strategies to stem the tide and set targets and reduction of suicide. For example, in Sweden, they set a zero road toll target by 2020. We should at least set a 50% reduction target in suicide over the next 5 to 10 years.
The review finds more people die by their own hand than are killed in road accidents or skin cancer. And it notes while Australia's road toll is more than halved in 40 years, there's been little change in the suicide rate. 2,535 people were killed in 2012, double the road toll.
Well, with the suicide figures as shocking as they are and the suicide attempts at this almost epidemic rate, the reason the public are not demanding action is because they're not aware of these facts, not sufficiently aware of those facts.
Kerry Kepper is determined her son's death won't be in vain. Through change.org, she's launched a petition to stop hospitals from turning away suicidal patients.
I've lost one brother, 2 sisters and a nephew, and now my son all to suicide. And I think I have grandchildren and I have 4 other children, and I'm so terrified of what might happen should they, any of them, have mental health issues in the future.
I have a fire in my belly like I have never had in my belly before. This cannot go on. We cannot have this differential healthcare system that says you get great care if you have cancer, you get the world's best care with cardiovascular, but you get crap care if you can find it, if you have a mental health condition.